A cutting-edge technique is being used to treat wounds and disease at OSF St. Francis Medical Center in Peoria. Dr. Eric Martin, the Chief of Vascular Surgery at the hospital, joins us now to tell us all about it. Good morning, Doctor.
Good morning,
How are you?
I'm fine, thank you.
Good, good. Thank you for joining us this morning. First, can you tell me, what is regenerative reconstruction?
So regenerative reconstruction is using technologies. We use xenograft with either cow, pig, or even fish, and we combine that with human products that either come from the placenta, the umbilical cord, or from the amniotic sac, and we use these tissues to help regenerate wounds in patients that are very decompensated, debilitated, have multiple medical problems that otherwise would not have a good solution for healing. And by putting these products in patients, we're able to regenerate and regrow portions of the human body that otherwise would have been susceptible to an amputation.
Wow, that's very helpful for your patients.
Very much so.
So how does this prevent patients from needing amputation?
Sure. So OSF prides itself on being a center of excellence, and one of the areas that we focus on is an advanced limb salvage. A lot of patients that come in with very bad peripheral artery disease that have been afflicted with high blood pressure, high cholesterol, diabetes, and smoking, these patients go on to develop tissue loss. And this tissue loss is in the form of either gangrene or ulcerations that don't heal. And once we restore blood flow to patients, we're now able to provide them with alternatives to help address very complex wounds that would have otherwise resulted in amputations of the extremity because the infection was so bad or there was so much tissue loss to bone and tendon. But now with these new technologies, we're able to salvage limbs and save limbs that otherwise would have been, the end result would have been an amputation.
Wow, that's so interesting. So can you tell me what people could benefit from, regenerative medicine?
Sure. So more people than actually what you would think. Sometimes trauma patients that come in with severe degloving injuries where there's a lot of tissue loss to an extremity, patients that suffer from burns, maybe second, third degree burns, they would also benefit from this technology. Diabetic patients that have diabetic foot ulcers, patients that have arterial disease where their circulation is compromised and they go on to develop ulcers in their extremity. And also patients that have venous disease, people that have circulation issues where they develop venous ulcers that don't heal. All of these people would be candidates to undergo this sort of therapy.
Wow, okay. So tell us some of the fascinating things that you've been able to accomplish using this.
Sure. So we've had two actually very unique cases recently come through our hospital system. Besides the wounds that I mentioned to you earlier, we've had one case of a rare condition called pyoderma gangrenosum. Now, this was actually in a rather heavy-set male, weighed over 400 pounds, and also had a problem with his lymphatic system, so he had something called lymphedema, and he developed a very rare condition called pyoderma gangrenosum. And what pyoderma gangrenosum is, it's a rare autoimmune disease that causes ulcerations to occur where your own body's immune system is attacking the skin, and it causes ulcerations to develop. And over the course of 14 years, this man started off with a small ulceration about the size of a quarter, and it actually grew to encompass both of his entire lower legs. So like from the foot, all of the calf and his entire front of the leg was completely covered with deep rodent ulcerations. And then he came into us with secondary infection, was actually in septic shock, and with the use of this regenerative medicine, we were able to cure him, a disease process that was there for 14 years in about 3.5 months. And we were able to regenerate and regrow tissue. We had to cut all of the tissue out from his skin, the fat, and all the way down to the fascial layer of his leg. And then from that, we were able to regenerate and rebuild all that tissue and skin graft him with a successful result. The other patient we had recently, too, is a lady that had a condition called calciphylaxis. And this is a rare condition where she had a kidney disease, and from there she also developed ulcerations, and we're healing her.
Okay, awesome. Well, thank you so much for joining us and talking with us about this, and we'll share more details on our website.